Most accident injuries don't show up right away. Don't wait until it's too late. So I always like to talk about the fact that there are two types of injuries. There's chronic and degenerative, right, where small amounts of damage take place over time. And then there's acute injuries where, maybe you're at work and you pick up something heavy and you rotate and all of a sudden you develop back pain, or it could be a sports injury, or it could be a car accident. We see those pretty often. So in terms of brand new injuries, we can injure various tissues in the spine, but something that's very common that people come in with are things like disc herniations. And disc herniations represent damage to the ligament, basically, that connects the two vertebral bodies at each segment in the spine. And it is a very dense, very broad ligament. It is part of the structural tissues of the spine, but it's also close to neurology. So in many cases, when we have a disc injury, we can also have irritation to nerve roots, and that's typically when we'll sort of develop the arm pain or the leg pain associated with it. And we call that, a radiculopathy. Most commonly in the low back, we can call that sciatica. A lot of patients come in and say, hey, I have leg pain, I have sciatica, and it's not always true sciatica, but in many cases it is. That's typically related to irritation of the nerve root where the disc injury took place. If we have a disc herniation, we always have what's called an annular tear. And the reason why I say that is because the annulus is the outer ring of the disc, and that surrounds sort of a gelatinous material on the inside. A lot of people talk about the jelly donut. I don't love that analogy. It's a really dense, broad ligament. It's much stronger than a donut or a pastry. But essentially, when that annulus becomes torn, then the inner material can herniate towards the outside. The most common reason why that happens is the disc is really susceptible to rotational forces. So a lot of times, when somebody's bending forward and twisting at the same time, it can cause that disc to tear or cause that disc to become damaged. A lot of times with complex sports injuries, a very similar mechanism of injury takes place, and it injures the spine, specifically at the disc. And we see it really common with auto accidents. As you can imagine, the level of force that goes through an occupant in a vehicle and even a minor accident is really significant, and that can damage structural tissue in the spine, like I said, most notably disc herniations. So injuries are an important part of what we do, primarily because what I like to always discuss is, when we have an injury, when it's relatively new, what we need at that particular stage of the game is healing. We don't need to just manage symptoms. Yes, we need to triage patients. We need to make them comfortable so that we can find long-term solutions. But at the end of the day, when we injure our body, there are certain tissues that don't have the capacity to heal in much the way that other tissues do, right? And the force from an injury or an accident doesn't selectively injure the disc. It injures all of the tissue in that area. And we can have injuries to facet capsules or ligaments or myofascial tissue, even associated joints like hips and SI joints or shoulders if it's a cervical issue. So we really want to address where the injuries are and then make a plan so that we can develop long-term solutions to getting that patient recovered and back to where they need to be in terms of pre-injury status. Yeah, so an ideal time frame following an injury is, typically about 4 to 6 weeks post-injury. I think it's about that time where we have to start looking at entering an interventional model, right? So in the beginning stages, we're in the acute phase. There's lots of inflammation. There's lots of damage. It's really important to triage the patient, to start some conservative care, to get their body to start healing to a degree where essentially we can control the inflammatory environment. Once we get them through that initial acute phase, then we enter what's called the subacute phase. And within that phase, then it's about restoration of function, restoring and maintaining function so that their body can heal appropriately. Now, what happens typically when we have structural damage like a disc herniation is our body's really good at healing muscles and tendons and skin and even bone for that matter. But once we get past that initial phase, our body isn't as equipped to heal structural tissues. So essentially, if we have a disc herniation, or if we have ligament damage, or if we have, damage to the joint capsule, the dense structural tissues of our body, then essentially what will happen from that point forward is that it won't heal completely. Your body won't have the ability to overcome that injury. And more importantly, down the road, it will become a degenerative process. Now, we're not talking, within a year or two. We're talking, 5, 10, maybe 15 years down the road. The problem, though, is we deal with residual pain and dysfunction because that tissue is still injured, and we can go through periods of exacerbation and remission because that tissue has not had a chance to heal. that we have to deal with on a daily basis in terms of our life and the ability to function and work and do all the things that we want. So, the sooner we get there and provide a healing resource, the sooner we can get that patient recovered in terms of overcoming the injury that they sustained initially. However, we don't want to go in and start looking at a regenerative approach, even a Discseel approach, that early on, because we want to control the inflammatory environment. So I would say about 4 to 6 weeks post-injury, we can start looking at the structural damage and then developing a plan so that we get them the long-term outcome they're looking for. And I think the biggest mistake that most people make is that when they have pain, they try to solve for the pain. I get that. At the end of the day, when we have a really large disc herniation or a large enough disc herniation, and we have irritation to nerve roots and we got the leg pain and it's really significant and it's really consistent. So it's something that they experience for extended periods of time, and they're starting to fail in the traditional model, meaning that epidural steroid injections or oral medication aren't enough to really overcome that problem, then typically the only other tool available would be surgical intervention. Now, with a surgery for a simple disc herniation, right? So we don't have gross instability, we have a simple disc herniation with nerve impingement. That's typically what we call a microdiscectomy laminotomy, where they cut a portion of the disc out, they make room for the nerve. We can take the pressure off of the nerve, we can take the irritation off of the nerve, and we no longer have the leg pain. Why that's important is because irritation to nerve for long periods of time can lead to dysfunction, right? It can lead to weakness in the extremity, and that's a really bad thing because sometimes we can't recover it. So there's always a risk of leaving that irritation in place for long periods of time. It's also extremely painful, and it also inhibits their ability to function in the real world. Now, with what a Discseel procedure does is it takes the surgical element out of the equation. We no longer have to cut discs out. We now have the ability to seal the disc in a minimally invasive environment, typically with an injection, and provide the same level of relief, which is to get pressure off of the nerve immediately, but then over time have the ability to heal the disc and restore the normal structure so that we have that long-term function that comes along with it. Please be sure to check out our other videos, and if you have any questions, please leave them below.